Most men carry health questions they never speak out loud, not because they don't care, but because topics like erections, size, urination, or sexual performance are wrapped in shame, silence, and unrealistic expectations. Yet these questions are normal. They are human. They are medical. And millions of men around the world deal with the same concerns every single day. I have spent years working with male patients, from teenagers struggling with performance, anxiety, to older adults worried about urinary flow, prostate changes, or declining confidence. And across cultures, professions, and ages, the same three concerns appear again and again. Why does my erection weaken when I start overthinking? Why do porn stars look so massive, and does my size measure up? Why does my urine sometimes split into two streams? These questions may sound different on the surface, but they share one thing in common. They all speak to a man's private relationship with his body, identity, and confidence. Today we'll break the silence. We'll explore what science actually says about these issues, why they happen, and what you can do to reclaim your strength and peace of mind. This is not about judgment, not about comparison, not about masculinity as the world has twisted it. This is about health seen through the lens of biology, psychology, and the realities of modern life. Let's begin with the most common and misunderstood issue of them all. Section 1. Psychogenic erectile dysfunction. When the mind interrupts the body. 1.1. What most men get wrong about erections. Many men believe that if their erection fails, even once, something is permanently broken. But here's the truth straight from years of clinical evidence. A single failed erection means nothing is wrong with your body. Even multiple failed erections often point to anxiety, not disease. In fact, for men under 40, up to 87% of erectile dysfunction, cases are caused by psychological factors rather than physical ones. English auto-generated URL. Things like performance anxiety, overthinking, fear of disappointing a partner, stress, sleep deprivation, porn-induced expectations, past negative experiences. Your body is capable. Your blood vessels and nerves are working, but your mind is hitting the brakes. 1.2. How the fear loop starts. The cycle usually begins with one unexpected moment, a stressful day, a bit too much alcohol, an argument, a rush of nerves, or simply fatigue. The erection softens. You don't expect it. You don't understand it. And now you're embarrassed. The next time intimacy happens, you're not focused on pleasure, you're preparing for failure. Your body senses the anxiety, shifts into fight or flight mode, and suddenly, heart races, breath shortens, muscles tense. Blood flow is redirected away from the genitals toward the limbs. Your brain says, "This situation feels dangerous." Your body replies, "Then this is not the time for sex." Psychogenic ED isn't a weakness. It's your nervous system misunderstanding the situation. 1.3. Parasympathetic versus sympathetic, the battle inside your body. Erections require the parasympathetic nervous system, the rest and digest mode. Anxiety, however, activates the sympathetic system, the fight or flight mode. These two cannot dominate at the same time. If anxiety wins, arousal loses. Every time. 1.4. Why this is fixable for most men. The good news. Psychogenic ED is often temporary and reversible. With the right approach, anxiety decreases, blood flow improves, confidence returns, erections normalize. In hundreds of patients, I've seen this transformation happen within weeks to months. But to break the cycle, men must understand the next layer of the issue, the emotional impact. 1.5. The emotional consequences most men hide. When erections falter, many men withdraw from intimacy, avoid dating, fear being judged, lose confidence in their masculinity, beat themselves up psychologically. But here's something every man must hear. Your ability to get an erection does not define your worth. Your masculinity is not measured by biology. This issue is treatable, manageable, and incredibly common. You are not broken. Your body is not failing you. Your mind simply needs support, and support is absolutely possible. Section 2. The truth behind Pornstar size. A business, not biology. 2.1. Why men compare themselves to porn. Most men have learned about sex not through education, but through pornography. This creates unrealistic expectations in two areas: size, performance. Porn turns sex into performance art, not real intimacy. 2.2. Global penis size, data real, not myth. The global average erect length is 5.4 inches. Most men fall between 4.3 and 7.2 inches. This includes over 90% of the male population. But performers in adult films are not chosen randomly. 2.3. Why pornstar size looks unreal. Porn actors often appear larger for several reasons. 1. Selection bias. Only the top 0.11% of naturally large men are chosen. 2. Camera angles and lighting. Close-up wide-angle shots exaggerate size dramatically. 3. Shaving. Removing pubic hair increases the perception of length. 4. Medical aids. Some performers use vacuum pumps, traction devices, temporary dermal fillers, PDE5 medications like sildenafil or tadalafil, cock rings to maintain engorgement, 5. Implants. In very rare cases, some performers have surgically implanted inflatable devices not for size, but to maintain erections during long filming sessions. 2.4. Why size doesn't predict pleasure. Research consistently shows what matters most to a partner is confidence, intimacy, touch, rhythm, stamina, connection. Size contributes far less than most men assume. The obsession with measurement is cultural, not biological. 2.5. Emotional damage from comparison. Constant comparison can lead to lower self-esteem, body dysmorphia, anxiety, ED, avoidance of intimacy. But here's what I tell every patient. Porn is not real life. You are comparing yourself to an edited movie. Your body is normal. Your worth is not a number on a ruler. Section 3. Split urine stream, what it actually means. 3.1. The embarrassing but common situation. You stand at the toilet. You aim. You expect a straight stream. Instead, 2 streams shoot out in opposite directions, catching you off guard. It happens to millions of men. 3.2. The biological explanation. The urethra is a tube. If the opening at the tip is partially blocked even a little, it disrupts the flow. The most common cause? Dried semen or mucus at the urethral opening. After ejaculation, residual fluid can linger and dry, causing split stream, spraying, slight discomfort at the tip. This usually resolves after the next couple of urinations. 3.3. More serious causes. Sometimes a split stream signals underlying conditions. BPH, benign prostatic hyperplasia. Urethral strictures, scar tissue narrowing the urethra. Inflammation. Prostatitis. Men should watch for warning signs. Weak flow. Dribbling. Hesitation. Frequent night urination. Burning. Sudden urgency. Pain in the perineum. If any of these occur, a urologist evaluation is recommended. 3.4. Simple practical fixes. Sit to urinate, especially in the morning. Stay hydrated. Take a warm shower if the tip feels irritated. Avoid pushing or straining. And if symptoms persist, medical evaluation is important. Section 4. Prostate health and the hidden signals of the body. 4.1. The prostate's role in urinary and sexual health. The prostate surrounds the urethra. As men age, it grows naturally. This growth can cause weaker urine flow, hesitation, split stream, dribbling, frequent nighttime urination. This is not a sign of failure. It's part of the male aging process. 4.2. Early warning signs of cardiovascular disease. The penis has some of the smallest arteries in the body. That means erectile changes can appear years before heart problems. When blood vessels begin to stiffen or narrow, the penis is often the first place symptoms appear. 4.3. Supplements that support prostate function. Science-backed ingredients include saw palmetto, pugum, nettle root, green tea extract, beta-sitosterol, lycopene. These help reduce inflammation and support urinary flow. Section 5. The Action Plan. Rebuilding confidence, erections, and health. 5.1 for Psychogenic ED. Step 1. Rule out medical issues. Blood tests, hormone checks, cardiovascular evaluation. Step 2. Reduce anxiety. Focus on touch and intimacy without penetration. Step 3. Consider short-term medication support. Low-dose tadalafil used daily can help break the fear loop. Step 4. Therapy helps rewire patterns. Cognitive behavioral therapy is highly effective. 5.2 for size concerns. Stop comparing yourself to pornography. Improve circulation through fitness. Focus on breathing and pelvic floor strength. Use traction devices only if medically supervised. Avoid risky surgical enhancements. 5.3 for split urine stream. Hydrate. Sit to pee in the morning. Shower after sex if residue causes blockage. Track symptoms. See a urologist if flow weakens. 5.4 for prostate health. Daily habits. Regular exercise. Anti-inflammatory foods. Hydration. Supplements saw palmetto, pygium. Avoid excessive alcohol. Empty bladder fully before bed. Section 6. The emotional and psychological side of men's health. Men often suffer in silence. Why? Because society teaches men, don't show weakness, don't ask questions, don't talk about your body, don't express fear, don't admit confusion. But this silence harms generations. The truth is, men who seek help are stronger, not weaker. Men who stay informed live longer, healthier lives. Men who value their bodies enjoy better relationships and intimacy. Health is not a battle against masculinity. It is the foundation of it.